Okay, welcome everyone to today's information session hosted by the Health Services MPH program at the University of Washington. This program lives in the School of Public Health, more specifically in the Department of Health Systems and Population Health. My name is Lauren Sikowski. I use she, her pronouns, and I work in the communications team in this department. I'm the marketing and student recruitment specialist for this program, as well as a few other programs within this department. So a few logistics before we get started. I will send the slide deck out after this for you all to reference. So don't worry about writing down every single detail because you'll have it later. And there will be links in the slides to relevant information. And throughout the presentation, please feel free to either make use of the chat box if you have questions or temporarily unmute yourself to ask questions out loud if using the chat box isn't comfortable for you for whatever reason. I might take questions as they come in, or I might hold them for Q&A time, just depending on how we're doing on time. And if you do use the chat box, you can either send questions privately to me or for everybody to see, whichever one you prefer. And then also no need to turn on cameras for privacy. We do record these sessions, so yeah, no need to turn on your camera. We can all just relax there. All right, so yeah, I'm gonna go ahead and get started. So the mission of this program is to train leaders in the field of public health, and we prepare students with analytical and practical knowledge and skills for improving health in diverse communities. Our students graduate prepared to work in partnership with communities to improve the health of all people. We teach our students a common language for identifying and addressing population health and public health issues and disparities, as well as approaches, methods, and principles for improving the public's health and the effectiveness of healthcare and population health services in the United States. We also teach our students to understand the means by which social inequities and racism generated by power and privilege undermine health. So now we're taking a look at some demographic information of recent cohorts. Our students come from a wide variety of backgrounds, academically, personally, and professionally. So in a typical year, we'll admit average 41 students, could be 35 to 45 students in a given year. And historically, our program is more domestic US citizens and permanent residents. You can see that international students, this is a much lower number at 17%. We do welcome international applicants, but the reason that this has been historically lower has to do, for one, with the content focus of the program. So this program is primarily focused on domestic issues of population health and the healthcare system in the United States. There is some comparative health systems content early on to help our students understand the US model in a global context, but then it takes a deeper dive into the specifics of US healthcare matters. And then Washington residents are over half of our students. Average GPA, recent, we'll get into GPA, but this is just what we see from our incoming cohort, 3.57%. And then students of color have comprised around 62% of recent cohorts. And then we have a breakdown there more specifically of how that all shakes out. And then gender demographics, we have over 3/4, we have 78% identified as women in their applications, 19% identified as men, and then 3% either didn't identify as men or women and or used non-binary pronouns. So yeah, that's fairly consistent with what we see in the field of public health. And none of these factors are considered when you're applying to the program, but prospective applicants are definitely interested in knowing about the demographic information. So we like to share it. So the format of our program is full-time on campus, and students must complete at least 10 credits per quarter to be considered full-time. And there is no online or remote learning option as part of this program, and also no part-time option. There is an online MPH program, and I have the contact info here on the top of the slide if you're interested in reaching out to them. The online MPH program does have a part-time option, but yeah, it's just a separate program from this one. It does live within this department though, but I would definitely recommend that you reach out to them to learn about that program. And our program length is 2 years, so 6 academic quarters, and 63 credits are required to earn the MPH degree. And UW is on a quarter system, not a semester system. So we're talking about quarter credits. Now, if you're more familiar with a semester system, you can think of this as being compared to like 42 or so semester credits. 51 credits will come from your required courses, and there are also 3 credits of practicum experience and 9 credits of a culminating project. And we'll dive more into those projects later on. And then we offer 3 tracks or concentrations within this program. So first we have the generalist track. This is going to be your most flexible option. This will accommodate individual learning interests, which include the possibility of taking concurrent degrees or graduate certificates. It's going to be your best option for that. So in the generalist track, students will satisfy the degree requirements, and then they'll be free to take an individualized set of courses from the concentration offerings or from other UW departments. And then we have our social and behavioral sciences concentration. Here, students learn to apply social and behavioral sciences theory and methods to the study, practice, and thought of public health. They look at the relationships among social, cultural, and behavioral processes, health and illness, what society does and can do to promote health and prevent illness. They'll gain skills that include survey research, statistics, behavioral measurement, ethnography, quality of life assessment, community-based participatory research, and cost-effectiveness analysis. And then last, we have our health systems and policy concentration. This is for students who seek a career of leadership in public or private efforts to improve the performance of the health system. They'll become well-grounded in public policy development, health economics, law, and ethics, and acquire a deep understanding of how and where public policy is developed, what forms it takes, who the relevant actors and institutions are, and the economic and legal forces that affect and are affected by public policy. And then we'll have links in the slides that I'll send out later with more info on each of those concentrations. So before I dive into the curriculum, I'm actually going to go back to the slide. So before I dive into the curriculum, just a note on picking your concentration that you apply to. So when you apply to the program, you will apply directly to one of these 3 concentrations. Don't apply to more than 1 concentration, like don't submit more than 1 application to this program with, say, generalist and social and behavioral sciences concentrations, because you will only be you'll only be reviewed by the admissions committee once. So we don't want you to waste your time or your money. All that being said, if you do apply to a concentration, maybe you apply to the generalist track, but then decide that you want to move into the health systems and policy concentration or vice versa. You apply directly to that concentration, but you want more flexibility later on, you can do that. Once you're in the program, you're in the program. You just need to make that move, that concentration move by winter quarter of the first year. So not a ton of time to make the decision, but you do have that freedom once you're in. so now we're going to dive into the curriculum. So I'm going to show first the curriculum for the generalist concentration, and then the two other concentrations. We'll quickly go over the other two concentrations, like what the differences are. So I highlighted some of the main points in yellow for the generalist track. We can see that we have several elective or methods courses. That's how I said that, this concentration gives you the most flexibility. You're not going to have as many electives, as many choices with the other two concentrations. Those are going to be much more prescriptive, much more laid out for you what you're going to take. But something that is common with all three concentrations are our PHI courses. So this is the foundation of the MPH here at UW. So the public health interdisciplinary courses, all of our MPH programs in the entire School of Public Health, with the exception of 2 of the programs, will take these PHI courses together as a cohort in the first year of study, and these will address the foundational competencies that are required for an MPH degree. And these courses expose each cohort of students to diverse perspectives of public health and give them an appreciation for those in different disciplinary backgrounds. And the cross-cutting themes that we're looking at are ethics and equity issues, global and local perspectives, communication skills, systems thinking, leadership and collaborative skills, and the evidence to action and back cycle. And this will develop a common language or schema for understanding public health concepts across programs. So when I say that all of the MPH programs, there are several MPH programs here at UW. There are 3 in this department, in the Health Systems and Population Health Department. But then there are also 6 total departments in the School of Public Health that each have MPH programs. So there's an MPH program in environmental and occupational health sciences, and one in epidemiology, and one in global health, and one in nutritional sciences, and one in public health genetics. And I realized I just said one. Some of these departments have more than one. So yeah, but lots to think about as you're deciding which department and which MPH program is right for you. Yeah. But anyway, so in these PHI courses, you'll be literally taking these courses with students that are not just in the health services MPH program. They'll be also in other programs. Yeah, so that's the PHI courses. And then we also have 2 quarters of seminar. That's designed to exchange information about matriculation and works in progress. It also functions as a forum to meet the faculty, learn about practicum, thesis, and capstone opportunities. And then there's also, as I said, the space for electives or methods. And then we're going to move into the social and behavioral sciences curriculum. So I won't repeat what I already said. You can see that we do have the PHI courses. And then in gold, I highlighted the specific courses for this program. So we have strategies of health promotion, advanced qualitative methods in anthropology and public health, health program evaluation, health communication and marketing for health promotion, theory and practice. And then we have thesis courses. This is a recommendation. This is not a requirement. You can do a capstone with this if you want to. In fact, a lot of the MPH programs are moving towards capstone anyway, but some folks out there do prefer to go the thesis route, and this has historically been a concentration where students have gone the thesis route rather than the capstone route. And if you don't know what that means, I will go over that in a little bit here. And then here we have the health systems and policy concentration curriculum. So here we have health systems and policy course, health policy research, health economics, health policy development, and then we have some capstone courses for your culminating project. And you can see with both of these, there are still some electives. There just aren't as many electives as there are in the generalist concentration. So you're not going to have as much flexibility. And one more thing I want to note is that some people are very drawn to one of the two more prescriptive concentrations, but they're not like 100% sold on it. So what you can do is apply as a generalist, but look at, for example, the health systems and policy required courses and sort of cherry pick the ones that you want to take as a generalist, and then, really kind of tailor the degree to what you need. But yeah, that's what some folks end up doing. All right, so diving into the practicum. So this is the experiential learning component of the degree. This is a planned, supervised, and evaluated field-based experience. It's a minimum of 160 hours of work in the field under the guidance of a site supervisor and a faculty advisor with a public health organization. And this would typically occur at the midpoint of the program. So usually in the summers between years 1 and 2, and this can be conducted locally or nationally. And this provides students with an opportunity to apply the disciplinary knowledge, methods, and values that they've been learning in the MPH classroom to a professional public or private public health environment. Could be in nonprofit organizations, hospitals, local or state health departments, or for-profit firms. The goals here are to, like I said, integrate, synthesize, and apply knowledge and skills from the classroom and gain that hands-on experience, and develop specialized knowledge in a topic that's interesting to you. So the deliverable here is a written assignment, a visual assignment, and at least 2 student-generated products produced in the practicum setting. And there's my typo. Produced in a practicum setting, and forget those last 4 words, please. And yeah, so some folks might come in with an idea of where they want to do this work. It might be here in Seattle, it might be back home. Like maybe if you're studying rural health in Idaho and you want to go back home for the summer, you could certainly do that. But if you don't already have an organization that you have arranged to work with or want to work with, we can help make those connections for you. We have tons of local connections that our faculty can help arrange. And yeah, there are tons of compelling examples of the practicum projects that our students have done. And those are linked here in the bottom left of the slide. You can't click it now, but you'll be able to click it later when I send those slides out. Okay, culminating project, so thesis or capstone. So all MPH students, regardless of their concentration, are required to write either a thesis or a capstone project. And this is conducted with the mentorship and support of a faculty advisor. The goal is to develop specialized knowledge in a topic of interest, integrate, synthesize, and apply knowledge and skills from the MPH classroom, and produce a meaningful contribution to the field of public health. So the thesis is a research project designed to generate new, broadly generalizable scientific information about a public health issue. It must be appropriate for publication in a peer-reviewed journal. And many of our students do publish their research. And then a capstone, to contrast, is applied problem-solving project designed to generate practical solution to a public health problem. So it may not be generalizable. It could be specific to one region, one population, or one organization, and it may not be appropriate for publication. It could be confidential to a host agency. Oh, and then also I definitely encourage folks to check out some examples of thesis and capstone when I send out those slides. All right, so moving into career outlook. So very strong for our alumni. This program has been around since 1969. We're actually the oldest MPH program at the University of Washington. We even predate the founding of the school by 1 year. And we've graduated over 1,000 alumni. And our alumni work as public health practitioners and researchers and leaders in universities, research and policymaking organizations, the healthcare industry, and government agencies across the United States and around the world. In a recent survey, 99% of our alumni were employed in public health or related fields. And yeah, we have a great alumni network here. You can see in the bottom left, we have a map of America. This is where a lot of alumni have landed from that recent survey. So one thing that we can do as our students are getting close to graduating, and they say, they might reach out to us and say like, hey, I'm thinking about moving to LA. Is there anyone you can connect me with? And we can make those connections. And our alumni are generally very happy to either connect with us, connect with our students, sort of help be a foot in the door, or just give a little bit of mentorship and advice. But also our alumni will often connect with us, our students, at like conferences and events. So yeah, great network to be a part of. We also have great career services here at UW. That's an entire department in the School of Public Health. They post jobs often. They also host webinars like how to find a public health job, how to stay sane while finding a public health job, what types of public health jobs are out there. Like they might have panel conversations with alumni. So that's also a benefit. And then, yeah, top right, we have a pie chart just showing the different sectors that folks have landed in. So we can see that the majority are working in healthcare. We also have folks working in academia, in government, private health sector, community health, and then a small percentage are self-employed. And then here we're looking at some sample career titles of actual alumni. We've just removed their names. And I bolded what the titles are. I won't like read out the entire job titles with, with the company names, but for y'all to reference, I've also separated them. So we have the top list is folks where the MPH is their highest degree earned, and then other folks who also have a doctoral degree. So we're looking at a theme of leadership here for sure. We see program or manager, project director, high-level analyst, research coordinator, and field operations lead, quality improvement manager, medical officer, director, senior research scientist, professor. So yeah, definitely want to highlight the fact that it's gratifying that the point of this program is to train leaders in the field of public health, and it's nice to see that we are in fact doing that. Yeah, it's great to see the career successes that folks go on to have. Okay, so admissions timeline. So we're done with admissions for the 2023 cycle. And then so we're looking ahead at fall 2024. So for fall 2024 admissions, our application cycle will open September 1. That's when we'll start accepting applications. And then the deadline to apply will be December 1st. And then by mid-March, really it's mid-February, our admissions committee will convey their decisions to applicants, let them know if they've received offers. And then by April 15th, that's when we want the folks that have received offers to let us know if they plan to join us in the fall. And then late September, classes begin. So It's a pretty long lead time. You basically apply in the fall for the following fall. So the minimum admission requirements have been set by the University of Washington Graduate School. So at a minimum, we need to see a bachelor's degree from an accredited college or university in the United States or its equivalent from an international institution. And then a minimum of a 3.0 GPA on a 4-point scale for the last 60 graded semester credits or the last 90 graded quarter credits. And there is a grade calculator tool here that's pretty helpful for finding that. And this isn't necessarily your the cumulative GPA that shows at the bottom of your transcript. It might be, but it's the most recent GPA taken. So if you've maybe you either have another graduate degree, these could be graduate level courses, or maybe if you've taken additional courses since completing an undergraduate, those would be included. So yeah, most recent credits. So our approach to admissions is an important part of our commitment to equity, diversity, and inclusion. So every year we train our faculty reviewers on principles of holistic admissions review. And we use a standard rubric to make sure that faculty review and rate applicants fairly and equitably. So when we do this review, these are some of the criteria that we balance as we consider the whole applicant. So first, we look for applicants who have a clear passion for public health, and we look for strong academic background. Our program is rigorous, so we want to see that students can succeed. And letters of recommendation are important, as well as students' prior work and volunteer experience. We also look at life experience that could be relevant. And then we want to see that the career goals make sense and that there's a fit basically between the applicant's past progression of their training, their ultimate goals, and then what we can offer in this program. And then faculty interviews are not needed for part of the preparation to apply. If you want to connect with faculty, there'll be lots of opportunities to get connected as an accepted applicant, as an enrolled student. But when you're applying to the program, that's not a hoop that you have to jump through. So before I get into the application instructions, I want to quickly talk about application fees and fee waivers. So the way that it's set up with all MPH programs at the University of Washington is that they require, the main application is through SOPHAS, and then we have a supplemental application that's going to be through Slate this year. So for SOPHAS, there is the fee to apply to the first program is $140 and then $50 for each additional program that you apply to. And they have their own their own fee waiver policy, and you'll apply through them. And I definitely encourage folks to look at that and request waivers if you qualify. But I definitely want to note that last year, SOPHAS did run out of waivers literally on our program's application deadline. So there were folks who otherwise qualified, but they couldn't get fee waivers. So this year, I'm encouraging folks to get your applications in early because SOPHAS literally runs out. And we don't want our applicants to be denied things that they should get. Now, Slate for the supplemental application, the fee is $85. And we also have fee waivers for this application. This is through the grad school and through this department. So first, we want you to look at the UW grad school's fee waiver policy. And if you qualify through their policy, the greater grad school, go that route. If you do not qualify for a grad school fee waiver, look at our department's specific fee waiver policy. And this would be an alternative option to the grad school. But first check the grad school. If you don't qualify, then look at our department. And if you qualify, go that route. And for both of these, both applications, you need to request the waiver prior to submitting the application. Neither can be reimbursed. For the Slate application, you need to do it at least 7 days before the deadline because a human looks at your request and goes in and pays the fee for you. It's not like an automatic thing, so make sure you give enough time for a human to see it during the busy application cycle. Because again, we don't want you paying for things that you don't have to pay for. Okay, so now we're going to get into the application materials themselves. So starting with the easy one, Slate, this is the supplemental application. You'll first, I didn't list it here, but you'll give all of your like name and what who you are, that information, personal information, and then you'll report prior schools attended. You'll upload unofficial transcripts, so that's a PDF. We do not require official transcripts until after an offer is made. So don't have to worry about that until an offer is made. Basically, if you have access to the transcript, that makes it unofficial. So if you have a PDF or you have a hard copy that you can scan and upload as a PDF, then that is an unofficial transcript. An official transcript is when you have your prior school send it directly to ours. And then you'll need to start your SOPHAS application before you can submit your Slate application. And then once you start your SOPHAS application, an application number will populate and you'll need to share that. And another note on these two applications, last year some folks applied to the program, but they gave different names for some reason, like different first names for each application, and it made it just difficult for our team to like sort and identify who was who, or maybe they used different email addresses. So definitely encourage everyone to use the same name and the same email on both applications, just to make it easier for us to make sure that, we try to make sure that folks, say if you've started your Slate application, but you haven't finished your SOPHAS one, we try to keep track and reach out to folks and make sure that they're like aware that they need to submit both to be considered. So yeah, just use the same info on both, please. Okay, so the SOPHAS application, this is going to be your primary one, more steps here. And I do have much more detailed instructions at the link below, but just quickly going through the checklist, you're going to give us transcripts from every college or university where you've earned a degree or taken relevant coursework. SOPHAS, in order for your transcript to go into verified mode, they want you to order official transcripts and manually enter all of the courses on your transcripts exactly as they are written in the transcripts. You can also pay someone from SOPHAS to manually enter it for you, but then you still have to go in and review it and make sure that they did it right. So the manual entry part takes time, so another reason to start this early. Now, the nice thing here that I will say about SOPHAS is a lot of these steps, you only have to do this once. So if you're applying to our program and other programs at UW and other universities, you'll only have to do these things one time. It's not something you have to repeat again and again, but it is, at least when you're creating that SOPHAS profile, there's a lot of steps up front when it comes to transcripts. And then you're also, our program requires 3 letters of recommendation. These should come from folks who can speak to your capacity for success in the graduate program and ultimately to provide leadership in the field of public health. So these will commonly come from academic sources like professors, mentors, research PIs. They can also come from supervisors, either current or recent. And then you'll also provide an updated copy of your resume or CV. And then GRE is totally optional. We do not require that for this program, and most people do not submit GRE scores anymore. But if you feel like it tells a better story than maybe your transcripts of your capacity to succeed in the program, then, and you've already taken it, go ahead and submit those scores and we will consider them. And then English language proficiency scores if required. So you know your situation better than anybody else, but definitely encourage folks who, if English is not your first language, to review the UW Grad School's English language proficiency requirements. So those are linked here, and then the instructions about what type of scores are accepted, you know, who needs to submit them, what situations would get you out of having to submit them. Those are all listed here in the English language proficiency requirements. And then we also have our written statements. So we have 3 statements required by the UW School of Public Health for all MPH programs. So when you write these first 3, you aren't writing these just to our program unless you're only applying to our program. But just know that when you write these 3, if you're applying to any other MPH programs at the UW, then we will all see what you submit here, because you can only submit these in the application once. So just going through, I think I have it on the next slide. Yes, I do. So statement of purpose, here you'll describe your education, prior work and volunteer experience, and your professional career goals. Include why you're interested in public health and your career goals, your reasons for pursuing an MPH degree, and why you're interested in attending the UW School of Public Health, and then the skills that you hope to gain by obtaining an MPH degree. Then we also have our personal history statement. Here you'll provide a narrative about your lived experiences, obstacles you may have overcome, how these have guided you towards public health. This is not the same as your statement of purpose. Examples are who you are as a person, your family or cultural background, socioeconomic conditions, experiences growing up, including successes, challenges, moments of learning and growth. This question is not intended to ask you to share information that you're not comfortable providing, though. So just know that, but sometimes there are some lived experiences that could definitely, you know, are relevant to your potential to work in the field of public health, and are also just good to know about as we're considering you as an applicant. And then the equity, justice, and anti-racism statement. Here you'll describe how you might contribute to our equity, diversity, and inclusion efforts, and or how you'll learn and grow in the areas of EDI and anti-racism during your time at the UW, and then also in your public health work post-graduation. And then we also have questions that are required specifically by this program. So I think of the program personal statement as Chapter 2 to the statement of purpose. So this is explaining why specifically you're attracted to this program, to the Health Services MPH program, as well as your chosen track or concentration. So you know, it's not somewhere where you have to be overly redundant. You don't have to restate everything from your statement of purpose. Just like I said, think of this as like a chapter 2, like why specifically this program. And then there's an optional question, which we call the academic preparation question. This is where you could state if there's anything that's not obvious in your transcript or resume that you'd like to share that would indicate preparation for the writing and quantitative demands of the program. It's kind of just additional space for, you know, if you ran out of space to talk about academic preparation, and the other prompts. Okay, so now we're going to move into talking about tuition and fees. So this is an estimate based on the current year rates. So it's totally subject to change, but hopefully it gives everyone a pretty good idea. So UW is a state public institution, meaning that we receive a portion of our budget from the state, from taxpayers. And this enables us to have subsidized tuition rate for residents of the state of Washington. So we have a two-tiered tuition rate here for residents and non-residents. This doesn't apply to every single program. There are some fee-based programs, but this is not a fee-based program. This is a tuition-based program. So we can see the tuition for year one, and then the estimated fees, and then the total. So the first line is just tuition, and then we have fees, and then the total tuition plus fees in year one is that 24 or 41. And then the degree total, I just multiplied it by 2 to get an estimate. But we know that tuition tends to change every year. So like I said, it's an estimate. And then we can see a breakdown of what those fees are. We have the technology fee, services and activities fee, IMA bond fee, that's the intramural activity center. We have a really nice intramural, like athletic center. Facilities and renovation fee, and then the UPass fee, that's the transit pass. So that gives you unlimited access to transit on the train system and the bus, as well as water taxi. So yeah, that's how that shakes out. And then fellowships and scholarships. So the majority of our students are financing their degrees with a combination of student loans and work opportunities, either off campus or on campus. So those would largely be assistantships, like teaching assistantships or research assistantships or student assistantships. And these can be a great way to help pay for the degree, because in addition to a stipend that you would have, they also provide tuition support and provide health insurance. And these are jobs, so students do need to apply to them. And you wouldn't apply until after you're admitted to the program because they're posted regularly. But you know, the folks that are posting them and reviewing applicants want to know who they're actually looking at, which candidates they could actually potentially hire. So you wouldn't apply to these until after you're admitted to the program. And yeah, they are jobs, so they are competitive, but and a lot of people do want to apply to them. But like I said, they're posted all the time, like very regularly, and our students have great successes getting these, and yeah, great sources of funding. And then beyond that, we also have a variety of fellowships, awards, and scholarships available. So we can see some listed here. And these are available on the basis of different factors, including academic merit, financial need, and potential to contribute to the diversity of the incoming class. So this would include our H-Seat Award, which is $5,000, or the $20,000 Master's Fellowship Awards. And then we also have some great awards around different topic areas of study. Here we have the tobacco study. And then we also have links to additional funding information for the ASPPH. And then UW also has a service called the Graduate Funding Information Service, or GFIS, that I encourage everyone to look into. And then students may also wish to contact the Office of Student Financial Aid to learn exactly what would be available to you in your situation. All right, so at this point, I'm gonna pull it together and wrap it up, and then we can segue into Q&A. So to summarize, why pursue your degree with us? Why the University of Washington MPH program in health services? So we're training the next generation of public health leaders. We have a foundational commitment to equity, diversity, inclusion, and this informs everything that we do, how we teach in the classroom, what content we cover. We have for guest lectures, how we work with our community partners, how we confront microaggressions when they might occur in the classroom or in our workspaces. Everything that we do is informed by this. That's not to say that it's a utopia here. Certainly not the case, but it's, you know, a very sincere and ongoing commitment to doing this work and to making our spaces as inclusive and equitable as possible. We also have a terrific alumni network, which is very large with over 1,000 alumni. And our alumni are very well connected with us. They're involved with students and helping with student projects and mentorship and career seeking. So it's a very robust and valuable network. And our curriculum is rigorous and interdisciplinary, and we deliberately keep our class sizes small and use an active learning style so the students get the best possible experience they can in the program. And our faculty are, they themselves, world-class public health researchers and practitioners with strong community connections. And this informs what they teach and how they teach in the classroom, and they're able to really bring their real world experience into the classroom and helps them with making connections for you as you're looking for projects or for post-grad employment, and they're able to help be a foot in the door for our students. And we're part of the top-ranked UW School of Public Health, consistently one of the top public health institutions in the nation. And then, yes, Seattle is gorgeous. It's the largest city in the Pacific Northwest. If you already live here, then you know, but if you haven't, then I definitely encourage you to come visit and see how gorgeous it is. I'll say for myself, I'm a transplant originally from the Midwest, and then I've lived in Boston. I moved here in 2020. So I have some experience in different parts of the country, and I'd say I don't want to leave here. So yeah, I'm also happy to chat about Seattle if anybody has questions about that anytime. The pictures we have here are, this one on the left is actually from campus. This is Rainier Vista. It's the view of Mount Rainier with our famous cherry blossoms that bloom every spring. Then in the top right, we have the Space Needle in downtown Seattle and more Mount Rainier. And then the bottom right, we have the Puget Sound with the famous ferries and the Olympic Mountains in the background. It's just, yeah, it's a great place to live. And yeah, that's it for the formal side of the presentation. So at this point, if anyone has questions, feel free to put those in the chat box or to unmute yourself to ask out loud. Oh, looks like I already have one. Says, for people who are already in the MSW program, how to apply for the MPH as a second degree. So are you looking at, if you're looking at a concurrent degree, or? Yeah, so typically what would happen is you would apply in your first year in the MPH, in the MSW program, you would apply to the MPH program, and then you would pause the MSW program, do a year of courses in the MPH program, and then, so it would be like first year MSW, second year MPH, and then third year MSW. So it's kind of like, it's a condensed way to, the concurrent degrees are all informal. So they're designed for each student's particular needs, but they're typically just ways to, rather than having two-year degrees, you combine them and make it a three-year degree. But typically the MPH would happen in the middle of the MSW program. So I would say for your specific situation, I would, not sure if you're going to be in the second year, but I would reach out about your situation if you're already coming up on that second year and you haven't already applied to the program. And actually, you know what I'll do? It says, do I also submit all the application information just like someone outside the program? Yes, because you are outside of a program. So when you apply to any program, you have to apply to each program directly. We can't like access your MSW application and then analyze that. It's a completely separate application. And I might actually have that page up to share links, just a sec. Maybe I don't. Might be able to get it really quickly. Okay, here it is. I'm putting this in the chat box. It's a link to all of the concurrent degrees, and then you can click on each one and then learn about the steps for each one. Okay, so someone says, I'm curious what the specific course prerequisites are for each specific degree. On the UW website, it doesn't list specific courses under eligibility requirements. Yeah, that's because a lot of people come to us from a wide variety of backgrounds. You know, you may have a public health undergrad, or maybe you have an undergrad in like biostatistics, or maybe you have a undergrad degree in journalism. You know, so I'd say that there are things that strengthen your application. You know, having some public health or healthcare or science background would certainly strengthen your application, but you know, actual minimum requirements are, you know, we talked about that was having a bachelor's degree, the GPA requirements, and then meeting the English language proficiency requirement. Those are actual minimum requirements. But here, I'm linking the admissions page, which gives you more information on like what successful applicants usually show, in addition to those minimum requirements. Sorry, I'm scrolling here. Okay, so someone says, can applicants apply to multiple MPH programs at UW? Yes, absolutely. You can certainly, it says here, MPH in health services and MPH in global health. Yes, you can. Those are separate applications with separate admissions committees. So you do need to submit those applications separately, but you certainly can. You can also submit multiple applications to multiple MPH programs in the same department. So our department, the Department of Health Systems and Population Health, also has the online MPH program, and we have the MPH program in community-oriented public health practice. You can apply to those programs as well as this one. Like I said, separate application admissions committees reviewing your applications, and you need to follow steps for each program. You can't like apply to this program and then ask another program to like consider you. They won't be able to access your application. The only limitation that I was giving earlier was just that if you apply to this program, the Health Services MPH program, only apply to one of our 3 concentrations. So don't apply to like the generalist and the social and behavioral sciences concentrations, like just apply to one, because you'll only be reviewed once. Somebody is asking about the nutrition Masters of Public Health route. Yeah, I'm absolutely not an expert because I don't work in that that department, but they do have, the nutritional sciences department does have an MPH program, and I'll link that because I actually have that up. So all MPH programs at UW. So I just added that to the chat if you want to look. It's broken down by department. So you'll click on each department and then see what MPH programs they have. Okay, I'm scrolling again to see if I missed anything. Yeah, it's funny. Yeah, non-health related academic background. Some people maybe they were studying like, you know, politics, because we have a health policy. Like a lot of people are policy minded. You know, when I was saying journalism earlier, like health communication is a huge thing that this this program does. Maybe you were working at a nonprofit. You were working in like psychology. You know, we mentioned the School of Social Work. So yeah, it's, I guess psychology is health, but, you know, definitely a wide variety of backgrounds coming into this program. Okay, I don't see more questions coming in, but I do want to emphasize that my email is listed here in gold in the middle of this slide. So hservask@uw.edu. Please send me your question. Oh, someone on mute?
Yeah, actually, I had one more question, if that's all right.
Yeah.
Yeah, I was just curious. So I was the one who asked about like a non.
Oh, you muted.
Okay, can you hear me now? Sorry.
Yeah.
Okay.
Sorry, you asked
Yeah.
what?
So yeah, I was the one who asked about kind of like the non-health related academic background. I was actually a psychology major, and so I was kind of curious: is there a typical amount of time like that people will get non-academic experience or like work experience before applying to have a competitive application?
Yeah, I'd say, you know, it would certainly make you stronger if you have, like, I mean, the more time would certainly strengthen your application. We recommend, you know, that you have 1 to 2 years of professional experience, but we intentionally don't make it a hard cutoff, because you might have a combination of work experience that happened before or after your bachelor's degree, as well as, like, we're also super interested in volunteer experience, and life experience. Like, maybe your lived situation will help contribute to your potential, like in the field of public health, like depending on, you know, what you want to do with the program. So yeah, it's
Gotcha. Cool. Yeah.
intentionally
Thank you so much.
kind of mushy.
Gotcha. Yeah, that's kind of where I'm at, where I'm like a recent graduate and not totally sure what track I'd want to go into. So I probably want to get more work experience, which sounds like it'd be helpful. So yeah, thank you so much for just all the info.
Yeah, for sure. Anybody else have questions? No, so I have one. Will the MPH department see the material submitted for the MSW degree? No, we cannot access. Each admissions committee, each department can only access the application that you sent them. So we can only access the information that you sent to the Health Systems and Population Health MPH and Health Services program. We can't even, like, this program can't access the information that you provided to the online MPH program or the global health MPH program. So the applications are not transferable at all. You have to apply to each program separately. Yeah, for sure. All right. So I see we're at time. So I'm just going to again say, please send me your questions, hservask@uw.edu. I'm sure that more will come up after today. You can also book one-on-one advising through Zoom if you have more questions about your situation. And yeah, I just want to say thank you for joining me today. Hopefully this presentation helped inform whether this is the right program for you. I appreciate your time and your interest in the Health Services MPH program. And yeah, thank you and take care, everybody.